Hi, and welcome back to another episode of Healthy Mind, Healthy Life. I'm your host, Sayan, and this is the space where we slow down the conversation and have some real talk that quietly shape how we live. Today, I'm joined by Dr. Jeffrey L. Boone to talk about something that most of us have accepted as inevitable: heart disease and stroke. And we are going to look at why these conditions still take so many lives, what we have been missing in how we approach prevention, and what it would actually take to build a world where the next generation doesn't have to carry the same fear that we did. So, I invite you all to join me on this very informative conversation. And Dr. Jeffrey, I think it's a pleasure to have you here with us today and really hoping to learn something new, something more informative about how we see heart diseases and heart attacks. So, welcome to the show.
Thank you very much. Great to be here.
Likewise, Dr. Jeffrey. So, just a little disclaimer for all the listeners who have just tuned in right now. Some statements may reflect personal belief and experiences and are presented as individual views and not medical advice. Listeners should consult qualified professionals for medical condition. So, with that being said, Dr. Jeffrey, before we dive in, Doctor, I would love to start with your story. So, out of all the directions that medicine could have taken you, and it's a vast field, I think. What really made you commit to your work, to a future without heart attacks? Was there a moment that lit that fire in you? Or was it an instance or instances, a series of instances? What would you like to say?
Yes, very good question. Because my field is very unique. Medicine is a vast field with 1,000 different subspecialties that you could go into. So I was in the middle of America in Kansas, just a typical young man growing up. Fortunately, I had a good work ethic, and as we begin to take courses, study, I always just tried to do my best at everything I did, and so I got good grades, which is important, in America. And then as I went through college, did a lot of sports, tennis, basketball, football, all those, played those sports in college, and I majored in physical education, meaning the science of exercise. And then I got a master's degree in exercise physiology. So it was in the 70s when exercise was changing from just playing ball to the actual science behind fitness and the heart and weight control and health. So that interested me. And then we're still now in the early 70s, so over 50 years ago. Um, Physicians hadn't really adopted much leadership in that world. Doctors were taking care of people, but the disease of heart disease was very much a disease of lifestyle. Yet there weren't any doctors that were supporting that very much. And so I began to think about that. I had met my future wife Colette, and we were dreaming about our future. I was thinking about a PhD in exercise physiology, and then she said, "Well, why don't you go to med school?" So I thought you could just go down and sign up almost. I didn't know it was hard to get in medical school. But it was also about the time in the last decade that Dwight Eisenhower, who was the president of the United States, had had a heart attack. And his physician was Paul Dudley White, who told him he should exercise after a heart attack. And that was fairly revolutionary. And then as I was employed as a physical fitness specialist, I was leading the training of post-heart attack patients in the exercise to rehabilitate after their heart attack. And again, I began to notice that everybody was kind of beginning to get on board with that, but
Mhm.
MDs were not. And so I thought that I would try to go to medical school strictly to prevent heart attacks. And so that was very unique in those days. And so that was kind of the progression there. And I got in and was able to craft my training to always look at preventive cardiology. And the disease in those days, they were just learning how to fix it, not how to prevent it. And it looked like our fix-it approach was way too much, way too late. Bypasses, stents, heart attacks, sudden death was very common. So my career kind of spanned the development of tests and medications to stop that process. The problem with the disease is the first time you ever know you got trouble, you die or have a heart attack about 50% of the time. So the first symptom is you just die, and that's a problem. You don't get warning signs as much as you might think. And so the other thing about heart disease that really bothered me is that we never measured the disease. Usually you have x-rays or some imaging of the disease, whether it's pneumonia or broken leg. But in heart disease, we treated what we call risk factors, cholesterol, blood pressure,
Yeah.
and those are important, but they're not really diseases. They're just numbers that are predictors of the disease. So we pioneered starting even in the late 80s, 90s, the imaging of the heart, which isn't still common in America. The other thing, finances drive things, and most of the money, at least in America, is in the hospitals and everything is getting paid well to fix it. But if you wait long enough to know you've got it by symptoms, half the people are dead or disabled by that point. And so that was our whole approach, to begin pioneering strategies to image and find the disease early with ultrasounds and CAT scans, and then to treat it aggressively with, dozens of medicines we have now that can do that. And then still, even on the subcontinent of Asia, who to treat is unknown. You've got to image it to treat. Now we need the urgent people to take people to the hospital and try to fix them, but the best news would be to find it earlier and stop it aggressively and reverse it.
Okay, so that's really an interesting and I would say an inspiring story as well. And I'm sure since you have spent multiple decades into this field, I want to make this much more practical for the listeners listening to this today. So, Dr. Jeffrey, I'm going to ask a couple of questions.
Yes.
So, the first being, um, are there any early signs that are specific to heart attacks? I'm gonna say, and like you said, the numbers are obviously there, which work like a risk factor. Like you can only predict, and uh, you can say you can tell the probability that this is gonna happen. But are there any 100% accurate early symptoms, an early stage that one should look out for, perhaps?
Yeah, my main approach would be that if you wait for symptoms, you're in trouble, but still, recognize those symptoms.
Okay.
I think people need to look for ways to measure, do they have plaque or atherosclerosis, which is the biggest killer. One way you can do that is look at your relatives. If you have any relative, mother, father, uncle, brother, that ever had any heart attack, stroke, TIA, stent, bypass surgery before the age of 40, 50, 60 even,
Mm-hmm.
then you need to subtract 10 to 15 years from that and begin looking at yourself. Why did my grandfather die at 50 of a heart attack? Or why did my brother have a heart attack at 45? You've got the disease most likely. You need to measure it. And if you can't measure it with simple ultrasound of the neck looking for plaque, or CAT scans of the heart looking for calcium, or even what we're calling in America opportunistic imaging. Like
Okay.
if you have a car wreck and they image your stomach, if there's calcium in the aorta, you have plaque. If you get dental work done and you look at the dental x-rays, sometimes those will have calcium in the carotid artery or here. If you bump your head and get an MRI and they see minor plaques there, that's the time to treat it. We treat plaque, atherosclerosis, like we treat cancer. Now, the treatment sometimes is lifestyle, but an aspirin a day, a baby aspirin, very inexpensive. There are drugs called statins that people should take, and those are getting pretty inexpensive and available around the world. Um,
Right.
and then I think ultimately there are more medications along those lines. But look at your family history and subtract a decade from that to know. Look for opportunities to find plaque, especially if you have relatives that have had trouble.
Okay.
And then you find it and then treat it. So embrace the possibility and then treat it aggressively. And the medicines now, so then if you don't know if you've got plaque, then embrace your cholesterol. You want your cholesterol to be as low as possible. And if it needs a drug, that should be fine. You want your blood pressure to be as low as possible. And if it requires a drug, that's okay. Blood sugar. You want your blood sugar to be very well managed as well. And those are the three things that if I didn't know plaque status, I'd want to manage those. So a drug like, atorvastatin for cholesterol, aspirin, 81, a drug called losartan for blood pressure and a drug called metformin for cholesterol. Those would be the basics that almost every American needs by age 40 to be perfect. We're always looking for perfect. Every Asian, everyone in your continent, from Pakistan to Bangladesh to India, that there's a genetic inertia, and then the populations are beginning to live like America has lived for 50 to 100 years, which has made
Yeah.
heart disease the biggest disease in the history of the world, and we are eliminating other causes of death, and so cancer and heart disease emerge. Cancers are complicated, but heart disease is easy to stop if you know it, and it's hard to fix later on. Like, in India doesn't need more bypass surgeons, it needs more early detection and medication. Uh,
Right.
if you it's almost like you're on the edge of a cliff and everybody's being shoved off the cliff, and all of our resources go to the ambulances at the bottom of the cliff, as opposed to building a fence so you don't fall off the cliff. And, that's where the aggressive approaches. And they're quite
Yeah.
sophisticated, as well. On your continent, the development of CT scans, high-speed CT scans for the heart are, depending on economics and insurance, but you could actually do those to get a very, very elegant version of what's inside your arteries. But I think what we like to look at is redefining two words. What is significant disease? And in America, for a long time, significant disease has been chest pain, ambulances, stents, bypasses, hospitals. But to us, significant disease is even a tiny bit of plaque, treating it like cancer. In the cancer world, they don't tell you, oh, wait till it gets bigger, then we'll treat it. They go after it. But in the heart disease world, if we find that you're not having chest pain, you only have a 30% blockage, don't worry about it. It's not gonna hurt you. Wrong, totally wrong, and we're trying to change that. And then aggressive care is aggressively optimizing your, genetic risk, your anatomic risk, your physiologic and biochemical risk, which is really blood work, and there's some fancy genetics that you can take that cost a few $100 here, but they'll tell you, do you have a certain genetic inertia? But there's something about your ethnic subgroups that are having more trouble, uh, and that needs to be further worked out and investigated, because people are dying way too much of this as they're developing very successful lives.
Agreed. I think that was spot on, Dr. Jeffrey. So, we tend to look at things like cholesterol or high blood pressure, and you have already named a few of the medicines. So I want to take this a level further and ask you. So someone who knows that they have these symptoms, say they have detected these symptoms early on. So what are the few medicines that they should always carry with themselves, because I'm not sure if you have heard about this drug called sorbitrate. So it's very common in India, and that's something that people here carry with them all the time, especially specifically those who are struggling with any kind of high cholesterol or blood pressure. So maybe a few, and also, Dr. Jeffrey, I think you're the best person to ask this, that what are the some very rare symptoms, okay, in the sense, rare in the sense that you're in middle of a heart attack. What would you really like to say, like, in that moment, what you should do, and what are the few medicines that maybe you should always keep by yourself? So I think that would really help our listeners listening to this today.
Yes, I think, while I'm very much wanting people to find the disease before they have symptoms, on the other hand, most people, they're going to be assessed by symptoms. So,
Mm.
in your typical physical activity during the day, whether it's walking or working hard, if you ever start feeling some heaviness in your chest area, or some shortness of breath, or a little more intolerance to the exercise, or walking the stairs, you're feeling more trouble, especially if you've had a family history of heart attack and stroke, or you have a personal history of high cholesterol, high blood pressure, things like that. Take that very seriously. That could be reduced blood flow down the arteries of the heart.
Mm.
Then, especially in women, the pain of heart disease often expresses itself differently. Jaw pain, belching,
Okay.
other things can mimic that. So, any change that seems to be brought out by exertion is a very good hint that you might have something wrong. I was on a podcast from a guy in New York City the other day, and he was talking about, he was kind of a skeptic of what I was talking about, but it was funny. His name was Mind Dog. What a name. And he goes, I don't know if this is a spiritual thing. And he's, talking like New Yorkers do. But he said, the last week, every time I carry luggage around my house, I get pain in my chest and shortness of breath. And so we had a good long talk, but I kept saying, Mind Dog, you need to go to the hospital. And then I told him he was in New York, I'm in Denver. I said, you can even fly to Denver. I'll do a free evaluation on you because I think you got heart disease. And I remember we finished the interview and I could hear him talking to his audience and he goes, he probably doesn't know what he's talking about. Well, a week later, he called me up. And he was in
Oh,
the
wow.
hospital, and they were putting a stent in it. He had taken our advice, gone to the hospital, and he had a severe blockage, and he was probably on his way to a heart attack. And the
Wow.
more we had the discussion, the more I kept bringing him back to his own health because all of a sudden, all of his brothers had died in their 50s, and now he's 60s. I mean, didn't take a genius to say that he's in trouble. So anyway, that was so we saved the podcaster, but but yeah. So I think looking for those symptoms, um, and then I think being aggressive, like I tell, to let your doctors be the ones that decide things for you. You decide yourself. I'm worried about this. I want to, what can I do? Ask your doctors. A lot of doctors like it when their patient really is engaged. They're actually pushing the doctor. What kind of tests could I do to see if I got anything in my heart? And these high-speed CAT scans now are very inexpensive to look for calcium because as the plaque grows, it turns to calcium in the coronaries, and that's kind of a good way to,
Wow.
to pick up the early plaque and then realize then to me, that puts into guidance what I should do with my cholesterol, blood pressure, blood sugar, things like that. And then the medicines are getting better than ever, so I'm not seeing much in the way of side effects with things. But,
Mhm.
and then with women, people never expect women having heart attacks, but a woman should take seriously any sort of new, just like indigestion, aches or pain, shoulder pain can sometimes be a heart attack, uh, jaw pain, gastrointestinal distress. For men, it's a little more classic. Something's kind of heavy on your chest but still take those seriously. Sometimes if they even occur during mental stress, even if you're out walking around, that can be important as well. So check that out. How are the doctor situation in India? Does everybody have a doctor they can go to and talk to, and for the most part?
Yeah, I mean, for heart disease, I think it's very common here, and definitely, I agree with the CT scans that you talked about earlier. I think the drugs as well. Certain advancements in some of the drugs have really reduced the side effects. So I can say that, um, I would say that from reducing the heart disease standpoint, I would say that the main challenge still remains early detection because, once that's detected and that's ignored for a prolonged duration, and when it adds up, I think that is when the trouble happens. So I think we are focused way too much on the cure rather than prevention. So I think this conversation is going to be extremely important for anyone who's listening to this, perhaps, and perhaps looking at their science and their numbers this week. So I think this is really extremely useful, Dr. Jeffrey. So I really appreciate. So what are some of the drugs that they could carry with themselves, which are proven
Yes.
to stop heart diseases almost instantly, open up that artery, open up that valve so that blood flow could improve during that kind of failure.
There seems to be a benefit from carrying aspirin. Aspirin, generally a small aspirin, we call it a baby aspirin here in America. 80 milligrams of aspirin is a pretty good idea to take daily. Now, what happens is the plaques that kill are growing inside the artery wall, and the plaque will crack and a clot will form. So the aspirin doesn't get rid of the heart disease, but it prevents a clot that might cause heart attack, stroke. Generally, I recommend to my patients that are getting older or we know they have atherosclerosis or heart disease, I'll recommend that they take 181 milligram a day, and it might be 80 milligrams. I think in Europe or Asia, it might be 75 milligrams. Sometimes it's in a packet or chewable form. That's good. Now, if you find yourself in the middle of some event, like, oh man, I'm feeling bad. I've got shoulder pain, my chest hurts, got jaw pain, then chew 5 of those all at once. So people could carry that around, and that actually begins to dislodge the clot that has probably formed on top of a plaque in the brain of the heart. So those 5 aspirins, Bayer in America makes these white aspirins. They're kind of crummy to chew up, but chew a couple of those up. That's a good thing. On your way to the emergency room is a good idea. Now, you mentioned this drug that started with an S, sorbitrate, or what was it called that people carry?
Yeah, I think it's the same drug that you're mentioning. So here it's mentioned as
Yes.
carbohydrate, I believe.
That's right, because it's
You can chew it up as well.
yes. So that's probably your version of the aspirin, and that's a very smart one. Now, the other thing is a nitroglycerin, but that's usually given only to people that know they've got serious blockages and that are having chest pains, and so I don't know that that would be for everyone to carry around. And then I think embracing, like even all of my children are in their 30s and they're already on the statin drugs, which are now worldwide, ubiquitous, inexpensive. And I have found a lot of our patients, we've had patients from Dubai to Vietnam come visit us, and the access to drugs, it's actually often much cheaper than in America
Absolutely.
to get good drugs. And so I would look very aggressively if your blood pressure is even slightly above normal, then a drug that ends in ARTAN, losartan, valsartan, those are very nice low symptom drugs. We work with a lot of professional sports teams here in America, and those are good blood pressure drugs for athletes because they have no limitation on your athletes. And your world, what is it? Cricket and rugby and tennis and squash and all kinds of great athletic games. So anyway, the athlete wants to not hurt his performance, but we want to protect the athlete. So and then other drugs in America that end in PRIL, Acupril, Quinapril. So those 2 drugs are almost for everyone because they've been found that even if you don't have typically described hypertension, the guidelines for blood pressure drop 5 or 10 points every year. So really the best blood pressure to have is one that barely keeps you standing, so as low as possible. And then the more stressful your life or stressful your job, blood pressure will surge in that regard. And so I think if you don't have bleeding or bruising, taking one of those tiny little aspirin every day is good, period, and then chew 4 or 5. And if you don't have, if you have a little high blood pressure, then taking the ACE inhibitor or the ARB, which are those 2 drugs. And then I think the bias is to overtreat with a statin. So if your doctor or you have just borderline cholesterol, that's enough for me to say, just take a statin, because I think they're very inexpensive, and they all end up a rosuvastatin, a torvastatin, simvastatin. Those are all the generic names of those drugs, and they're fantastic. And they tend to not just lower cholesterol, but they stabilize plaque in the body. Um,
Wow.
and then that cornerstone of aspirin, artin, statin is just fantastic. And if you have really high cholesterol, you add something called ezetimibe. Now, there's a guy in Australia named Nichols who's been pioneering a triple drug formula with a little bit of statin, a little bit of ezetimibe,
Okay.
and a little bit of
Okay.
bempedoic acid. So, there are ways we're looking at treating the whole world with this. And I think we're also pioneering. We got very sophisticated ultrasounds and CAT scans. But if you just did an ultrasound of this carotid artery of the neck in all of Nigeria, you would find 50% of the people that need the drug. Same thing you could do with all of South India. You could find the people that need the drug, and those machines are available. We had a group the other day was even talking to us about opening Boone Heart. The name of our clinic is called the Boone Heart Institute, opening Boone Heart Rwanda in the middle of Africa. because the rest of the world is now developing this as the biggest cause of death.
Wow, I think that's very, very informative for all the listeners listening to this right now. And it's quite interesting to know the different, magnitude of the effects and side effects that you also describe with these drugs, Jeffrey. So I think that's going to be really, really helpful for the listeners listening to this today. And yeah, so folks, something that I would like to also share across before we wrap this off is that always focus on getting these things diagnosed. Focus more on the prevention rather than cure, because it's always good to have that cure. I mean, with the advancements in drug specifically, we I think Dr. Jeffrey, we are really doing good. But from an individualistic standpoint, I think it's always good to have those checkups being done. And like you said, specifically if you recognize that you are you have a family or relatives who have these kind of diseases and previous mortality. So I think that is what today's message would really be, Dr. Jeffrey. And of course, the drugs that you mentioned, I think that's going to be really helpful for all the listeners listening to this right now. So Dr. Jeffrey, for people who actually resonated with this conversation, found this helpful, and wants to connect with you and learn more about your work, perhaps takes your guidance as well, where's the best place for them to find you at?
Yes, they booneheart.com is our website, and it would give you an example of the very aggressive work. We think we're, the best in the world at trying to prevent heart disease. Now, the next step is to not just get it to our patients, to the whole world. And then a fourth drug that I didn't mention, but there's a drug called metformin that is a pre-diabetic drug, and that would be another good one for your listeners. So the metformin, losartan, rosuvastatin, and aspirin. And if you got everybody aged 30 to 40 in India on that combination, you'd eliminate about half of all heart attacks, probably, if you got it going early enough. But yeah, I'd love to talk to people there through that website. Also on Barnes & Noble and Amazon, our new book, A World Without Heart Attack, kind of goes over the history and why things happen. And here we've got one of the richest countries in the world, yet all the money often goes the wrong place. In America, insurance companies, hospitals, everybody's scrambling for the money. We're one of the few clinics that talk about just stopping a disease and not about, like, even insurance is mostly in America interested in the cost of your health, not your health. And then I just listened to that book, Everything is Tuberculosis. And, we've got the cure for tuberculosis, yet almost 1.5 million people die of tuberculosis. And much of that is because of greed and lack of things. So I think there's a lot of things that could happen with podcasts like yours to get the word out there. If we can get more, hopefully we're moving into the next 20 years of doing the right thing. Too much of my half of the world has been just greedy and, and hoarding as opposed to helping. And I think the whole world is starting to realize it just doesn't make you happy. Make you happy is helping other people. And I think even in the tuberculosis world, we could stop that as well. But ultimately, even all across the world, the biggest cause of death is heart disease, and we can now prevent it with the appropriate strategies.
Wonderful. That's a very strong message indeed. And yeah, I think after all, I think from your standpoint as well, Dr. Jeffrey, I totally agree, because I think helping another individual should be, as you age, I think you realize that maybe that is the purpose of life at all, how you can help another soul reach their goals. And so I think that is, again, something very philosophical to perhaps end this on as well. So for the people who actually resonated with this conversation, folks, I'll link the book and the website so that you could easily find Dr. Jeffrey. So folks, if you stayed with us throughout this conversation today, I want to thank you, because I think this episode reached you for a reason. So you need to hear that you're not just at mercy of your genes or your past. Take care of your heart and listen to the symptoms, listen to your body. And folks, with that, this has been Healthy Mind, Healthy Life. I'm Sayan, and yeah, take care of your mind tonight, and we'll see you in the next one again.